There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: my blood pressure is 150/100 and I am 26. Should I start taking medicine? Answer by Joe Van Schoklik. Of the 8 answers so far, just one is right, and this only partly so. It is distinctly possible that you have high blood pressure, but the number of 150/100s does not inspire confidence. The fact that both your systolic and diastolic readings end in 0 suggests to me that someone has taken a single, rather sloppily done reading, and that everyone so far is prepared to condemn you to lifelong treatment on this basis. Of course, you need to see a competent clinician, and they should make sure you do have high blood pressure. This involves taking several readings over at least 2 visits, using meticulous technique and a recently, properly calibrated sphygmomanometer. At least one of these readings should be taken manually, as a small proportion of people will find that an automated sphig will give them a grossly wrong reading. The readings should be averaged, and appropriate criteria used for diagnosing high BP. If the reading is equivocal, consider wearing an ambulatory BP monitor for at least 24 hours. If you do have high BP, appropriate lab tests on blood and urine should be reconciled with careful history taking and a thorough examination. The treatment, if needed, should also involve good dietary advice about e.g. the DASH eating program. My 2C, Joe. As it has shown elsewhere, the current criteria put forward by U.S. cardiologists, ACC, AHA, are way out of whack, and I'm not alone in my criticism. Note that especially in younger people, due to current, rather lax sphig calibration standards, there will be a significant number of false positive diagnoses of high blood pressure, even after 3 visits, as I and my co-authors show in this paper. The image from MJA may seem inappropriate, and the article referred to overprescribing in older people, but if you start on unnecessary, lifelong drugs now, can you imagine how many you'll be on when you're 70? Make sure you need the treatment. Answer by Mohit Dang. A blood pressure of 150/100 is considered borderline stage 2 hypertension. What that means for you is that you need to be part of a healthier lifestyle with diet and exercise. You did not state whether or not you were on any kind of blood pressure medication or not, but if you are on a blood pressure medication, it is not controlling your blood pressure as it should, or you need an additional medication added to your current medication. Also bear in mind that physical exercise, stress, some over-the-counter medications, and things like eating a heavy meal can all raise your blood pressure, so if this is a one-time high reading for you, you may need to just monitor your blood pressure to see if it comes down on its own. Normally, it takes the patient monitoring his/her blood pressure for several weeks and then returning to their doctor to discuss the readings that were collected to decide if BP medications need to be started or not. Unless someone presents with a dangerously high blood pressure, then they would be immediately treated. Read more. Answer by Haidar Khan. Dear 26-year-old, I am not going to state how BP works, what's borderline and what's not. Your BP is high, well placed high. First thing you need to know, that kind of figure, if it's been persisting, is beyond your kitchen recipe control. You need professional medical insight and proper medical plan that works for you. Second thing, you are young, you may not be feeling full effect of it because your body is trying hard and has resilience. But it won't last forever. So book an appointment tomorrow. Like drop everything thing, make it priority now. Now means now, or else there is no else. You will get hit so hard you wouldn't know what hit you. So yes, 150/100 is bad. Yes, you need medicine. Yes, there are some healthy life choices you need to make. And now